All right, very good. Thanks, Jared. And thanks everybody for joining us today. It's been a while since we were together as this group for a while. So hope everybody had good holidays. And obviously the COVID roller coaster is alive and well for the new year with new twists and turns and things that make us raise our hands and scream, right? So thanks for being with us. It's getting kind of crazy out there. I know, Bob, you just finished up a nice Facebook Live event with Julie and Vivian. So nice job with that. Thought that was very good. And so Jason and Bob, whichever one of you wants to kick it off, go ahead. I'm recording who's here as we go, so we don't need to do a roll call or anything like that. We just thought we'd get some updates from some of the primaries, and certainly want to have everybody to give us some input on kind of what they're seeing and what some of their challenges are that we can talk about to see if we've got some ideas. We also sent out kind of a lessons learned draft document that we put together. Actually, most of that got put together last summer. So certainly there's some new knowledge that's happened since then, and we're adding to the dictionary as we go on a daily basis as far as what works and what doesn't. So more to come on that as well, but don't have to spend a lot of time on it, but if we can. I know Carla's got it'd be good if we could do USD 383 ahead of K-State, if that works out okay. She's got another commitment that she needs to get to fairly soon. So I'll turn it over to Jason and Bob. Thanks again, everybody.
Well, thank you again, everybody, for being here this afternoon. I do think everybody's got the materials that were sent out. We were probably actually going to jump right into some updates because I think between Julie and I can kind of give you some both bigger picture states and then also our local, and Jason will help take us through all of the updates.
All right. Why don't we start with Julie Gibbs and let her give an update on the situation in Riley County.
All right. I'm just going to read what I read on Facebook Live just a moment ago. We're currently monitoring 1,017 active cases. We've had a total of 1,202 new cases since last week. Our percent positive for last week was at 20.58%, and this is by far the most cases that we've seen since the start of the pandemic. We unfortunately did report 2 more deaths this week, giving us a total of 68 COVID-related deaths. We are still offering free drive-up testing through collaboration with KDHE on the weekdays from 8 to 5 at the mall parking lot. No appointment necessary, and it's free. It is a PCR test. We are also offering symptomatic rapid testing here at the health department Monday through Friday. So if you have symptoms, we're encouraging people to call our screening line. It's still the same screening line that we've had since the start of the pandemic, 785-323-6400. We are still providing COVID and flu vaccinations at the health department by appointment on Tuesdays and Thursdays. So to get scheduled, we encourage people to call 785-565-6560. And I did announce on Facebook Live, with the amount of cases that we've had coming in, our team can no longer keep up with the contact tracing. And this is what we're seeing across the state. Many other counties have already stopped contact tracing, or they're planning to stop. We did have a call with KDHE yesterday, and as of February 1st, they will no longer be doing contact tracing either. That's not to say we won't do case investigations. So we will still call the positive cases that we have, but we'll encourage them to do their own contact tracing. So we do have information available on our website. KDHE is coming up with a landing page for guidance for individuals who test positive or their close contacts. And that will hopefully be up and ready by next week so that they can direct people there. But overall, we're just really encouraging people to get vaccinated, get tested if they're sick, and if anything, stay home when they're sick.
Okay, anybody have any questions for Julie? All right, Bob, I know you all have been very active at the hospital. Maybe talk about what's going on, and maybe not just at Ascension, but at some of the other regional medical providers.
Sure, glad to do that. I think maybe to kind of connect in what Julie was sharing. So we get the data every Wednesday. And so I think looking at a full week is kind of helpful. So last Wednesday to this Wednesday, the 5th through the 12th, we did actually have 52,000 new cases in Kansas. That's between 9 and 10% of the total cases that we've had during the entire pandemic in 1 week. The 1,200 cases in Riley County is actually more than 10% of the entire cases through the entire pandemic for our just immediate region. And that has kind of set the stage then for great difficulty from the acute healthcare providers, the hospital providers, and the outpatient side with the clinics of kind of addressing all this. So we started this morning. It's kind of funny when you say we only have 14 positives, which is good. That's still about a third of our entire hospital census is positive COVID. 8 of those are on the medical unit. 1 of those is in the OB maternity unit, and the other 5 are in the intensive care unit or ICU, and all 5 of those are currently on ventilators. So certainly seeing, still continues seeing a significant number of patients. If you've been kind of paying attention to some of the stuff we've been pushing out to different parties over the last week, you would say, well, that's actually fewer patients, and that's true because we'd gotten into the lower 20s of inpatients last week, and one day was actually almost half of our census was COVID positive. Regrettably, in the last 7 days, we've also had 5 fatalities. And this is significant in that we've never had that many people pass in this short a time period from COVID. And we serve people from a number of counties. And so that's also, people kind of wonder, how come Bob and Julie's numbers don't always jive? And that's because we are serving people from other counties, Gary, Clay, Pottawatomie, certainly Riley County. The last fatality was actually from Wabaunsee County. So that's, I think, of significance. When we look at that specifically, we've got approximately a third of our fatalities have occurred in the last 90 days. So in the 22-month pandemic, a third of the deaths in the last 3 months. So that's also, you can see a disproportionate share in that time period. Certainly though, on the outpatient side, I was talking with a couple of our primary care clinic physicians today, two different specific clinics, and just really spoke to the high volume of patients that they're seeing. And that's kind of, it's a couple of things all happening at once. This is the time of year when we have flu, and we have flu this year, but there's also RSV, even adult RSV, seeing strep, and then also you kind of layer on all the COVID patients. So challenge for the clinics to keep up, because like many of us, they also have staff out, and that's obviously impacted a number of our local businesses. And I'm sure some of you can maybe share about that when we're doing the updates here in a bit. But no one has been immune to that, because we all have people who work, who have kids in the schools and have other activities. And it's hard to, not to be exposed, especially when something is so easy to pass from one person to another. So I don't know, anybody have any questions? Oh, I guess Jason asked about regionally. So pretty consistently, the entire states, our part of the world in Kansas, definitely seeing challenges, significant challenges in getting patients to where they need to be for the level of care they need. So ICU beds are at a premium. We still, on any given day, literally receive call after call from people all over the state begging and looking for places to put people and get them to where they need to get that level of care. And regrettably, we've not been able to accommodate much of that lately just because of our own kind of regional volume. So that is a constraint. We're also seeing a constraint on the other side of getting people out of the hospital, because we now have a number of the long-term care facilities, independent living, assisted living facilities who have a lot of staff out because of COVID. And so they are not able to necessarily take transfers. And so you kind of just get a little bogged down, if you will, not being able to get people out, and you're not able to take as many in as you might like to. So for us, it's kind of a shift by shift, day by day problem solving of figuring out, how we can take care of as many people as we can. Bob had all those happy things to talk about. I don't know if anybody had any question. Dennis?
Yeah, I have a couple of questions. I was out sick all last week and I was certain I had COVID. It turned out after a PCR I didn't, but my throat is hamburger right now, so I don't sound the same. I read a news report about Geary County closing their ICU. I don't know if that's happened yet, if it has, or when it does. What do you expect to happen to Via Christi? That's question one. The other one's a little simpler. I've read other news reports about elective surgeries again being paused and canceled in other places. So if you could address both of those, I'd appreciate it.
So Geary Community Hospital, they do have planned to close their ICU. That has not occurred yet. At least I'm not aware of that. I think that's still a few weeks out. And there's really, again, a combination, a number of factors that would drive the need to do that. You know, we'll just problem solve through that like we problem solve through everything else. A lot of hospitals in our state are doing a lot of things they didn't used to do. And so we have critical access facilities within an hour of here who've had patients on ventilators at some point during the last month when they would never have contemplated doing that 2 years ago. And so everybody's kind of ratcheted up the level of care they're providing. Obviously, that's not necessarily ideal. And so everybody's trying to work through that. But I think that's how we'll work through any transition with Geary Community. We will just all work together to kind of figure that out. On the topic of elective cases, so we have postponed numerous cases here in Manhattan over the last 3 to 4 weeks. We've managed to get everybody rescheduled, typically within a week, but we've certainly had to ask patients, and I recognize our community physicians for exercising a lot of flexibility in moving patients, moving from day to day, or maybe operating on a day they're typically in the office. And so they're rescheduling all their patients there just to try to get folks in, because we actually meet twice a day at 11:30 and 4:30 to discuss beds and who's going into what slot and how we move people around to accommodate that. There's some other places around the state who've actually completely shut down doing elective procedures again. So we consider ourselves actually fortunate that we're still able to kind of get through that. But I mean, I think especially over the next 2 to 3 weeks, that's going to be a challenge. We don't believe we've hit our peak yet. All the data would indicate we have more, another climb yet to do before we hit our peak. There'll be a short plateau, and then hopefully we start to go back down.
Bob,
Okay.
this is Karen. When you say hit our peak, do you anticipate that in the next 2 weeks, 2 months?
So if we assume that the Omicron here will behave like it did in the United Kingdom and in South Africa, and that's a big assumption, we would expect the peak to start hitting actually some parts of our country within the next week, probably here in Kansas, because we kind of lagged with that somewhat. We're probably within the next, somewhere around 2 weeks, maybe 3 weeks, but I mean, it'll probably, what is today, the 13th? It should still be this month, but late month. And then there'll be a kind of a short plateau. And then what we've seen like in South Africa is that it dropped, but it just dropped to a new plateau, a lower plateau, which is good. But it actually, and they've remained pretty consistent after that. So they still have new cases there. It didn't just stop. It's just dropped to a much lower level.
Thanks.
So this may be a question for Julie. We're running into at work and then and other event related situations where somebody says they have COVID and reporting out to people maybe who ran into them. So I guess number one, what's considered close contact? Number two, how do you treat something like that? What's the KDHE recommendation on treating a close contact, whether it's in a business setting or whether it's at home?
So KDHE just changed their guidance for close contact to fit the CDC guidance. So for the longest time, it was a little bit different. But now they fit the CDC guidance. So the CDC guidance is closer than 6 feet for longer than 15 cumulative minutes. We were always working with closer than 6 feet for longer than 10 consecutive minutes. So that has changed. So that guidance is put out on our website, Facebook page, that will be put out on the KDHE site, and that's where I would direct people to go if they are positive. They'd want to call all of their close contacts. So close contacts would be anyone that you had contact with within 48 hours of testing positive if you don't have symptoms, or 48 hours of symptom onset. Problem we're running into is sometimes they start symptoms, a week ago, and it could have been something else. You've heard of Flurona. So it could have been something else. And then they end up testing the next week and they test positive for COVID. And when they tell us there's an onset, they're thinking, well, I'm already recovered then, consider recovered after that 5 days. But actually we would with that situation go from the test date. So they would want to contact really anyone that they've been around since they've had symptoms or from when they tested positive. So it can be kind of tricky, especially with these guidance changes, but we're just really trying to make it streamlined. And thankfully, Vivian, our PIO, has put together a nice graphic for people to be able to determine, okay, if I'm positive, this is what I need to do. If I'm a close contact, this is what I need to do. So yeah, it's kind of a long answer to your question. I apologize for that, but there's been some guidance change. So.
I think, Jason, a lot of people have Dennis's experience where they're symptomatic and they may or may not be COVID, but they're symptomatic. And so I think key to go get tested, go to the KDHA drive-through or whatever, but that's also the time to start make sure you're wearing a mask, isolating as much as you can while it gets sorted out, because the symptoms are so similar between the flu. You have to remember, a cold is a coronavirus. And so it's just another kind of coronavirus. And so that's why it is hard to sift out. I kind of went through the same thing Dennis did the week before Christmas and had to get swabbed. And I wasn't positive either. I just had a cold of some sort. So it's we just encourage people. Step one is take some precautions. And then step two is get a hold of somebody, your PCP, primary care provider, and start sorting out maybe what's going on.
Okay. Gina.
Yeah, Julie, this might be an obvious answer, but is that graphic you were talking about available somewhere?
Yes, if you go to our website, RileyCountyKS.gov, you click on the coronavirus link and you should be able to find it there.
Thank you.
You're welcome.
Hello, this is Julie Govert-Walter, and I wanted to ask what the situation was with meeting the demand for testing. I know that some of our employees are going to need testing in compliance with the government mandate. And I just wanted to I wanted to get a picture or about how it looked like for health department to have testing supplies available and whether that was foreseen to be an issue.
That's a good question. We're doing okay right now with testing supplies, but we may not be in the next several months. We've been trying our best to keep up with demand with our rapid tests, but we know that the state is no longer able to fulfill any of our requests because they don't have the amount that they need. So it is going to become an issue, but right now we're able to keep up with it. We only do symptomatic testing here at the health department. So that's one common misconception that I think a lot of people that we've run into here. They'll call our screening line and want to be tested for travel or because they were a close contact, but we really need to reserve our testing for symptomatic individuals only. So we've been trying to get that message out that if you call the screening line, if you have symptoms, call our screening line. Otherwise, we're directing people to go to the mall. We know that the lines can get pretty long there too, but it is another option. It's a PCR test. It is free, no appointment necessary when you go to the mall. We're trying to drive people away from going to the ER. Bob and I have been talking about this because the tests are not free there and that won't be their first priority. So.
And our experience in it really does bog down the emergency room. And Julie, there was just something come out. The Supreme Court has made some movement today on a couple of topics. So the greater than 100 employee requirement is on hold or not going to happen. The healthcare is going to happen. So if you're a healthcare provider, there are going to be some requirements.
Okay, thank you. And my other question is there a need to reach out to our federal representatives in Congress or other places to let them know about testing supplies being a concern? Because I do think that, you know, hopefully this surge will pass and everybody's going to be fine and dandy. But the reality is that until it does pass, I think there's going to be a lot more demand placed on testing, particularly, you know, all of us want to keep our employees healthy, and that testing is a very important factor in making sure that people are remaining healthy in the workplace and other places in our communities.
Well, I think the issue of the testing supply chain issues, I actually think that's pretty well understood and known. I know locally here we've had a number of our primary care clinic testing sites who've had to drop out for a few days or more because they did not get their allocation or their shipment that week. And we do anticipate that that's going to become more problematic over the next month to 2 months. I think that's almost certainty. But I actually think it's a known issue. It's no different than we have a lot of other shortages with materials that we need. We're seeing shortages again with medications, certain materials. I think even things like sterile syringe to do flushes on IV sites, stuff like that has gone shortage or not available. Blood is a huge shortage issue right now. The antibody infusions that we use for outpatient positive COVID patients, we didn't get any this week. Our allocation was 0. So those kinds of things, I think, are that's going to be an ongoing challenge for us. But I think it's known within the government. It's just they don't have the ability, perhaps, to do anything about it.
Well, I only bring this up because, again, all employers want to keep their people safe and healthy. And, you know, the current administration has said, hey, testing and having supplies is a priority. And, hey, I know challenges happen. But if we don't have adequate testing supplies as we move into this further, it's going to create challenges. Some of us, you know, have policies that say, hey, if you're not tested, you can't come back to work, you know, stuff like that. And we just need to make sure that and communicate to those people who need to know that this is a problem and a foreseeable problem. That's just what I'm saying. And I don't know who the right entity to do that is, but I'm bringing it up here as a task force issue.
I 100% agree. It's as someone who was looking for a rapid test last week, it's virtually impossible to find. And while we do appreciate the folks who are standing out at the Dillard's parking lot in cold weather to do that, it was 2 to 3 days to get mine back when I needed one. So sometimes that varies, but it's incredibly challenging. And I do think, again, I do think our elected officials know it, and but we need to keep talking about that being a priority, I think. So any other comments or questions for Julie or Bob?
Hi, Kelly here. I did notice today that it was published that insurance companies were going to be required to start paying for testing kits beginning January 15th. So, for, people that might have some private health insurance, that might, kind of help maybe defray from having to go to the public health department, for a free test. If, private health insurance companies are going to start paying for that. It looked like they would pay up to 6 health, test kits per month. And that even included test kits that had 2 in a package. So, even if a test had 2 in a kit, that would count as 1. So just to kind of throw that out for some information to folks as well.
Thank you, Kelly. Okay, well, another organization that has been busy and adapting to everything is USD 383. As Ron mentioned, Carla has a definite endpoint, and so we are accommodating her to be able to go a little earlier than on the agenda. So Carla, if you have a 383 update.
I do, and thank you very much for letting me hop ahead. Most of you guys have seen the news today. We released to our parents and families this morning that we will be closed for our operations tomorrow. We are hoping that it is only for tomorrow. And for us, the issue came down to staffing. And we anticipated that. We've been talking about that if there did come a time where we had to close, it would probably be staffing related. Just to give people kind of a picture in their mind, during a normal week or a normal day, pre-COVID, pre-pandemic, it would be not abnormal for us to have about 50 teachers out district-wide, and to possibly have a substitute teacher shortage or gap of people not being able to fill those positions through a licensed sub. So somebody else from within the district would have to fill it, of about 5. Monday through Wednesday of this week, we averaged 85 per day absences, and we had a shortage of 15. That's 15 teachers that we were not able to get a licensed professional in to teach those classes. So that means the teacher next door is covering, we're combining classes, we're having to do a lot of stuff like that. I want to be clear or make sure that I acknowledge that our building administrators and our district level administrators have been pitching in during this time, even before we got to the point this week. Our district finance director was filling in at Eisenhower Middle School. Our director of elementary education was filling in at an elementary school. Our director of teaching and learning was riding school buses this week. So it is truly an all hands on deck effort this week. And we reached the point this morning, looking at what the absences were today, that we knew that tomorrow wouldn't be any better, and could probably and likely would be worse, actually. So the decision was made for us to be closed tomorrow. Monday is the Martin Luther King holiday, so we were already scheduled to not have school on Monday, and hopefully we will be back all in person by Tuesday. I think a couple of things I hope families and folks will think about as they spend this time is that we realize fully that it does create a hardship for families. It absolutely creates a hardship for families and employers in our community for kids not to have school tomorrow. But at the same time, it's not a good time for that to turn into a slumber party or other gatherings of kids or families. That this really, hopefully the purpose of us being closed tomorrow is for families to kind of hunker down. If you're sick, stay home. If you are positive or if you are waiting on test results, please stay home. Let's do what we can do to stop this as much as we can and get us back in person next week, because as Bob and Julie have both said, we've not hit the peak yet. It's still going to get worse. And if this is where we are right now, I'm concerned about where we go next. I also maybe want to just extend a plea to our employers. I don't remember who it was that just said it, but somebody just said, we have policies, and having shortages of testing and that sort of stuff makes it hard for us to know how to handle it as employers. And I think that for us, or the message that I would want to send to some of our employers right now, is that our policies maybe need to be written in pencil at the moment, or be ready for some editing and some changing and some pivoting, because there's just going to be some things that we put into policy when this started that just don't fit for where we are right now anymore. Your employees want to be there. They want to be at work, but they're also being placed into some pretty unwinnable situations and having to make some really tough decisions about how to best care for their kids, make sure that their kids are safe, make sure that they're not spreading sickness at this point, and then also to still protect their employment and obviously their housing and food and all that other stuff that goes along with that employment. So this just is going to be maybe a time that we all just are going to have a little bit more flexibility with each other. I think that was the main points that I wanted to make sure that I touched on. I'm really happy to answer any questions though that folks might have.
All right, anybody have any questions for Carla? Okay. Next on the list is, I believe, Linda with the Kansas State update.
Yep. Thanks, Jason. Thanks, everybody. Carla hit the nail on the head with flexibility is the key in our planning and operations right now. Of course, classes start on Tuesday, the 18th. So students are coming back this weekend. We are still planning to move forward with in-person classes. We do continue to have the mask requirement in place for when you're indoors on campus. The flexibility that we're adding in here, because the students are interested in that quality experience and education, which is why we're pushing hard to keep that in-classroom environment if possible. But the flexibility that all faculty have been given is that if they need to pivot to a temporary online classroom situation, they need to do that. It isn't an all university directive, but it's by classroom, by faculty. If they're starting to see a number of students not able to attend class, that they can pivot to online. Same thing is happening in the offices. We do have some departments that are getting hit pretty hard with people coming down with COVID. So it's, if you feel sick, don't worry about the testing. If you feel sick, stay home and work remote. We've really relaxed those remote working agreements. So during COVID, the guidance there is if you're feeling sick, you're better off just staying home. Don't worry about a test. We're following the CDC guidelines as far as isolation and quarantine. For students that are coming into the residence halls, of course, we know about the students that were there last semester and are returning if they've had their vaccination cards. New students coming in, or those that don't have on record a vaccination card, need to be tested before they come in. Lafine's set up to do that. But our Lafine Health Center is being stretched pretty thin right now, and obviously watching their supplies and staffing as well. But right now we're prepared to handle what we need to do to get students back in here. For events and meetings, we're just cautioning everybody. We're not setting limits on event sizes or anything, but be realistic. If you have an office staff together, you may not want to meet together in person because you don't want to wipe out an entire staff if they would come down with COVID. So a lot of meetings will continue to be remote or on virtual online. As you can see, we have our masks on because we're sitting next to each other in this office, but it is the masks on when you're on campus indoors. If you're in a private office, then you don't have to have it on then, but when you're out walking around, you have to have the masks on. So I think that's really about it. So we haven't canceled anything, but it is, like Carla mentioned, everything's flexible, and we meet twice a week to talk about the status of where we are on the testing on campus and what's going on. So if we need to make pivots along the way, we're prepared to do that.
Okay.
Linda, I had a question.
Sure.
I'm sorry. As far as sporting events go, indoor sporting events or activities, are y'all thinking or about requesting that the audience wear a mask, while they're there?
Actually, there is a requirement. Enforcement, as we all know, enforcement's a little more difficult at large events like that. But like in Bramlage, masks are required. The signs are up. The enforcement side is the difficult piece of it. So the requirement to wear masks is still there in Bramlage, and we haven't changed that. And they're just going to continue to monitor it. Right now, some people might be policing this themselves because the attendance levels are down. So some people may be opting just not to attend for their own, from a health standpoint, if you can't control the person sitting next to you for wearing a mask. So if they need to, there's right now, the way attendance is at the games, people would have an opportunity to move around and get spaced out from each other if they need to. But the requirement's there, it's just enforcement. So enforcement's a difficult piece.
Yeah, and I think most of you know this, we had a big event planned today and tomorrow, and it just came down to trying to figure out how we could enforce a mask mandate on a 2-day conference where people could eat and drink. And I think we decided we'd rather just wait than try to do that. Any other questions for Linda in Kansas State? Okay, our last update is from Fort Riley, and I know we have several on the call. Who's going to take the lead on that?
I'll take it. This is Major Evan speaking from the engagement cell.
Okay.
So on January 3rd, Major General Sims released an updated coronavirus general order number 13. If anyone wants to actually read the order, you can find the direct link on our website. There's a big button, yellow and black. It says coronavirus information. It's right on the main page when you load the website. Primarily for this order, it essentially added to previously existing mask wear requirements on post. To reduce the impacts of high national and local transmission and the effects of holiday leave travel, the updated policy says we'll wear masks indoors and outdoor spaces on the installation. Indoors personnel will wear masks unless they're in an individual space with the doors closed, like I am right now. So this includes all fitness centers, including those fitness centers we have identified as vaccinated personnel only. Those facilities are still for vaccinated guests. It's just that everyone has to wear masks now. Outdoors, personnel will wear masks in places they cannot maintain a 6-foot distance separation from each other. So this includes physical training, includes motor pools, field training, and formations. Division leadership plans on continue to reevaluate mask wear guidance in the next week as we kind of that spike from holiday travel hopefully tapers off a little bit. Also, as per 1st Infantry Division's COVID SOP, which will have a new revision coming out soon, I will be adhering to the new CDC guidance with regards to testing and quarantine of COVID positive individuals. Primarily, that includes a 5-day isolation requirement for all who test positive for COVID-19 and specific quarantine and testing requirements for individuals exposed to someone with COVID-19. All personnel returning from leave who are unvaccinated or who are displaying symptoms require a COVID test prior to returning to work. If they test positive, obviously they go into isolation in accordance with the above guidance. Now, regarding booster shots, vaccines, booster shots are currently available at all the IAC clinics, so the hospital on post, for eligible soldiers. So specifically, that's for those 6 months past their second Pfizer shot or Moderna shot, or 2 months past their Johnson & Johnson shot. Beginning January 10th, COVID-19 drive-through rapid antigen testing is available at Irwin Army Community Hospital's ground floor parking structure, and that goes on Monday through Friday, 9 to 11 a.m. For symptomatic beneficiaries only. That's specifically for them. There are no appointments for the rapid antigen drive-through tests. They're first come, first serve, and testing will remain open until further notice and will be closed during federal training holidays. So tomorrow, January 14th, and then also on Monday, January 17th. Now, active duty personnel must visit their respective soldier center medical homes for testing and cannot use the IACT drive-through rapid antigen test. So again, that's just for spouses, family members. DoD civilians who are not beneficiaries must consult their respective primary care manager. Patients who require a PCR polymerase chain reaction test must schedule an appointment with their patient-centered medical home by calling. We got 2 numbers if anyone needs them. Let's give them out real quick: 785-239-3627. Like everyone in our region, we're hopeful the spike peaks soon and plateaus, then eventually, levels out at a low baseline. So that's about it from Fort Riley. If anyone has any specific questions, you can let me know. Over.
Did anybody have any questions for Evan? Okay. Well, thank you, Major. We thought we might just do some general updates from all the task force members. And so maybe we can start in the middle of town. Dennis Cook, do you want to go first? And we'll kind of start branching out from there.
Sure, I can give you some update. At this point, I've seen, what we've seen so far is we're seeing more of our restaurants who are voluntarily masking up as far as employees go. But other than that, it's been business as usual, and business has been good. So we haven't had any issues, concerns. I know that it's kind of like the general population. We've had some people who've, they're a little low on staff, but a lot of that is because we don't have college students in town, and most of them are staffed by college students. So we're anxious to get them back in, and hopefully we can, hopefully we do see this peak and that we can get past most of this. So for us, business is good, and it's kind of business as usual.
Thanks, Dennis. Gina?
Hi, thanks everybody for being here during this time. We have come out of the holiday season really well. We've had some record-breaking sales, and things were looking really good. We have had some businesses close temporarily for staffing issues due to whether it's the really wicked cold that's going around or COVID. We've had lots of employee shortages for sure, where some of our businesses were on the verge of having to close. So that's really where we're struggling, although I would like to say that the businesses down here have done an amazing job of sort of policing themselves. They have closed sometimes out of abundance of caution, being overly cautious maybe, and really looking out for their remaining employees and the general public, and just doing really proactive work to take care of themselves and their patron base. So I really, as always, am so proud of these guys, just really taking care of each other and their employees. We will do whatever is necessary down here. I have so much confidence that our businesses will do what they did the last time we all went through this, and that is take care of each other and do the right thing. So we're looking forward to this peaking as well, and getting over and moving back into a normal baseline, whatever normal is these days. So that's all I have. We're planning on looking at the year as if we get past it and we move into a plateau and can carry on as business as usual, and we'll take care of ourselves in the meantime.
Thanks, Gina. John, I guess also while we got you on the spot, anything you could share from a state perspective would be helpful too.
Sorry, Bob, I didn't catch that last part.
I didn't say if there's anything else you could maybe share from a state perspective, that'd be helpful too.
Pretty much holding serve at Riley County. We have a couple of challenges in a couple of our departments right now that we're shifting and adjusting to at this particular point in time, kind of like everybody else. Everything else is kind of hold serve at this point in time. We've been trying to work with, of course, Julie and the other entities on finding an alternate indoor location for that KDHE testing site. I think we've got a couple of options there. Working and discussing some things on how to get some tests and those other important supplies in, and keep those stocked and ready to go as well. And just kind of working through this the best we possibly can. At the state level, obviously the legislature convened on Monday. Haven't really been hearing a lot on the COVID side just yet. I know here in the recent weeks, the Kansas Supreme Court, we talked about the federal Supreme Court and a couple of decisions that came down this afternoon, but they have basically upheld that SB 40 at this point in time. I'm still not exactly for sure the bits and pieces of that and how that works out, but at least for the moment, they've left that into place. So I don't know with everything that's going on, how that's going to play through and work out. The emergency declaration that was put in by the governor was pretty much specific for health facilities. So it's really not expanded to do anything locally in terms of reinstituting an EOC or anything of that nature at this point in time. I think it's to help you and your colleagues, Bob, and the health sector. And I know that yesterday, the State Board of Education also put a separate one in to deal with the scenario and the situation with the schools. So those are pretty specific. I don't know how the legislature in general is going to approach those and let those go a little longer term or add some things, take some things. I really haven't heard too much about it yet. My guess is as we probably get through the start of next week, we'll start hearing and probably seeing some things on that end. And that's really, it's really all I've got at the moment.
Thanks, John. Dennis Butler.
Yeah, good afternoon, everyone. As everyone else has said, and I won't get into a lot of details, since the pandemic started, we're seeing more employee absences due to illness than we ever have, probably in the last 2 weeks or so. Just prior to that, we had our very first, believe it or not, very first outbreak of COVID in the jail. We were able to confine it to one pod and keep everybody in there from infecting other parts of the jail. And it's pretty much subsided at this point. For the most part, the way we avoid it is anytime somebody's introduced to the jail population, we test them right away. And if they turn out positive, then we quarantine them away from the other inmates. And that's really prevented this from being a problem. We're not really sure how it was introduced about 3 weeks ago, but it was. And, again, we contained it pretty well and we're pretty much past it. Crime does not take a holiday. As you know, if you're in the healthcare business or other businesses, needs and customers still need us. And we are doing our very best to continue delivering those services. If you saw news reports yesterday, we had a conviction on a murder trial from an offense that occurred back in 2019 on all 6 counts, which we were very happy to see that outcome. But our officers and all of our staff continue to provide the services that you all rely on, and we are navigating the absences that I just described. As we were talking, when Carla Hagemeister gave her news about closing USD 383 schools tomorrow, I texted my division commanders and let them know about the news. And I said, this could affect your staffing. So just be aware that this just happened, and reminded them about school being out on Monday as well. That's not my dog barking, by the way. I don't know whose dog that was. I don't have anything else really other than we had this conversation throughout our meetings in 2020 and 2021. And I hope you all feel the same way, but I think we should do everything in our power to avoid a government-driven lockdown. I think these decisions should be made on a business-by-business basis, or a basis based on the kind of staffing that you have available to operate safely. And so that's my last comment, and I'll take any questions if you have any.
All right, Dennis. Thank you. And I guess this may be your last meeting with us. So thank you very much for your participation.
Unless we meet again before January 31st, this will be my last meeting. But thank you.
I think Jason and I are planning that. So, Karen.
Well, it's always a great opportunity to be able to share a bit of good news. And the good news is people desire to want to come to Manhattan, stay in our hotels and conduct business as usual. What we know, what we've learned through COVID is just like our group, it's great to be able to have that ability to meet virtually, but it's better when we can meet personally. I can tell you, I'm still waiting for the end of the year, how we finished completely the end of the year, but I can tell you week to week, during 2020, which we'd like to forget, we had no days, none, that we were over 50% occupancy. During 2021, we had 6 days of the week, 5 days of the week, I'm sorry, that we were over 50% occupancy. So slowly but slowly, we're improving. We've got a long ways to go to be back to where we were in 2019 prior to COVID. There are conferences that are being held in person. Some of the challenges that those conferences are having or facing, it's from our venues themselves, and that is just what we have talked about, whether it's schools, police, our own workforces, that it's staffing. It is making sure that staff is healthy, that they can be there. And then there's a little bit of a supply chain challenge as well, as far as getting food in, those kinds of things. And certainly Kelly and others that are in that restaurant business can address that as well. So we are in hopes that we do not have to close down, bring to a skid, but I do think the chamber's move to postpone and put the leaders retreat back a couple of months was a wise one, and we trust that our meetings that are being scheduled here can be very wise as they choose to meet here in Manhattan. So that's all I have. I'm happy to answer any questions anybody might have of me.
Okay, Cheryl.
Good afternoon, everyone. Really, the only thing I wanted to mention was recently attended a Social Services Advisory Board meeting. So just really checking the pulse with all the social service agencies, and they are working really hard, as they have been, especially during the pandemic. And with many of them, they're at capacity. You know, they're facing the challenges of trying to meet the needs of the community, and it's really hard, of course, in the winter months. But for example, the emergency shelter, you know, with the restrictions on space, then and with COVID, the impact of COVID, then that has been a challenge, continues to be a challenge for them. But they are partnering together really well. The need continues to increase. And again, as I mentioned, the winter is a difficult time, but it's really encouraging the way the agencies are working together to try to accommodate the needs of our community and those individuals who are struggling and have challenges, whether it's homelessness or just needing shelter during the day, or needing to get out of, to transition out of difficult situations. So that's the main thing I just wanted to share is that the strain is still there on our local agencies and the staff. And also when you run into situations of challenges with getting volunteers and what that looks like. And even with those individuals what we're just talking about as far as the challenges of childcare or being able to meet their family needs whenever someone tests positive. So agencies are still working hard and strong together through this transition, through the COVID challenges. So that was the main thing I want to share with you is we did get a lot of feedback from some presentations at our Social Services Advisory Board as far as the demands of the community and as those continue to grow.
Thanks, Cheryl. Kelly Loud.
Hi. Well, we, kind of to backtrack a little bit on what Gina said, about trying to be proactive. Russ and I decided to close the restaurant this week. We had been closed shortly after New Year's, just to have a little bit of a break, and knowing that it was, typically one of the slower times of our year. But we decided to close the restaurant for the week because we had a positive test show up amongst us, and just wanted to be proactive in that regard, and give our staff time if they developed any symptoms, that they would have some time down to not have to be short staffed essentially. So we're looking to kind of get ourselves retested on Sunday and make that decision moving forward next week. We too had a really good end of the year, I'm happy to say. What I have come to find in talking with customers and patrons is there's a lot of people in our community that are really supporting a lot of us independent businesses, and they it's really humbling and how supportive they've been and really care about how we are doing. So it's we, like I said, we had a really good year comparatively. For us only being open 5 days a week, and essentially 5.5 hours in the evening, we're really astonished how efficient we've become, how people gravitate again towards supporting us, making those, that time really count. It's, pivoting during this past couple of years has been really, really interesting to see how much more, tight we can become in our running a business. I want to say that our staff has been phenomenal. There is just no way that we could have ever made it through this without having, the kind of staff that we have. So, once again, here we are taking off the year being closed. It doesn't sound optimistic, but I think Russ and I kind of anticipated that this might come back around, just because we've been watching the trends, and so we're really fortunate that we were, that we can, that we're able to, do this economically. Right now we've kind of, really worked hard to keep our financials kind of a little more, tightly wound, and, just in case that we had to, close down again. So, we're going to, try to help out our staff financially, knowing that, the majority of them are, without a paycheck, steady, hours, coming in. We're just looking forward, to moving forward and getting this all behind us. But, I think, again, it's due to the support of our community that we're still here. And, we're really thankful for that. Any questions?
I do have a comment, if I could make one really quick. Kelly, when you were talking, it reminded me of something. As my wife and I have access services in our community, whether it's at the grocery store or a restaurant or any kind of establishment where we're buying something, we go out of our way to thank whoever is serving us for working. Oftentimes I've met with a confused look but other times people understand what I'm saying. And I'm very sincere when I say that. I thank them for coming to work because it seems like there's other options these days that people are making or decisions they're making that are making it difficult or more challenging for businesses and others to operate the way they used to. So I would just encourage all of you to consider doing the same thing.
Oh, very good. That's a great idea, Dennis. Thank you, Kelly. Julie, did you have anything to update?
Hello, everyone. As you know, our agency serves an 18-county region, and we see all kinds of interesting things happening. One thing I wanted to mention is that we've been very fortunate in that Ross Bowling, who is the chair of the Kansas Silver-Haired Legislature and a volunteer, is sort of a data guru. And he has been providing our board and our advisory council updates on how the COVID is affecting all Kansans, but of course his emphasis is on older Kansans, as well as hospitalizations and cases. We're planning to have Ross provide some of his information in a Zoom seminar later this month. But I just want to let you know, Ross is telling us, based on his data, that the situation we're in, and this was as of January 3rd, is not improved from where we were from 2021. And basically, the numbers are showing the same patterns and the same trends in the cases. So we are in a very significant surge, and it is predicted that it will get worse before it gets better, and I'm hoping he's wrong. But Ross is a great presenter, and he takes information from Kansas Department of Health and Environment and distills it down. So if anybody's more interested in Ross's information, we will be putting some of it out on our website, which is ncfhaaa.com. Our agency, since we are serving an 18-county region, and of course we're headquartered here in Manhattan, our focus is on keeping people safe. And when I say people, like all organizations and businesses, we're talking about our staff and the people that we serve. The challenge, of course, is that with not only the COVID, which we're seeing staff absences, and we want people to go home when they're sick and keep other people sick, because we don't want them going to the hospital and emergency rooms. So that's a challenge, and also our workforce issue. We have people in different working in the senior centers and friendship meal centers in our 18-county, where we pay what we can in terms of wages, but it is a challenge not only to find staff, but also to find substitutes when those staff members are ill. We're very grateful for the volunteers that are able to help us in situations when we have to fill in the gaps, shall we say. But that is a big challenge that we face, not only here in Riley County, but also throughout our region. I'll also say that our smaller locations, and I'm talking about those west of Manhattan and a few east, are especially vulnerable to possible service reduction and I'm talking about meals delivered to seniors, older Kansans, and their caregivers due to the effects of COVID. We haven't had a major service reduction yet, but we are dealing with, as many of you are, certain people's reluctance to go for getting the vaccine. And, our policies are in place, but it's enforcing them that are challenging when the workforce is not there to fill in these very important positions. So we're doing our best to address that. And to close again, I'll emphasize how grateful we are for the wonderful community support, as well as for our wonderful volunteers that make services for the people we serve happen and continue to happen in spite of the challenges. Thank you.
Thanks, Julie. I just gonna ask either Vivian, Steve, anybody else got anything you would want to add before we kind of move on? Because I think I've got everybody else covered.
Bob, I might just add some city perspectives. We've had during the holidays, we had some situations arise. We had to close the animal shelter because we had a couple of employees that were impacted. And when you have a small workforce, such at a confined facility like that, it doesn't take much to shut you down. So we also had a situation at one of our zoo camps that we had to close early, and some quarantine. So we're dealing with those issues. We certainly are feeling it in some of our other divisions and departments where they have small groups and folks out for one reason or other, either COVID or close contact or quarantine. So we're certainly dealing with those issues. We kind of pivoted at the first of the year to really focus on trying to take care of our employees and controlling the things we can, instead of wearing constant badges or zebra shirts and enforcing things in public areas. So that's been a challenge, but certainly we tried to upgrade our PPE so that with the variant and stuff, that we had a good supply of medical grade masks and K95 and others. So one of the things I have heard is a little bit from some of those social service agencies that Cheryl was talking about is, their income generally is down. Fundraising efforts have been curtailed. They've been on the short end of the stick the last couple of years if they're getting state funds, whether it's special alcohol money or just the social service money in general. TG transient guest tax, all of those are down. And so, for them to have to go out and buy a lot of PPE for their employees and stuff is a challenge. So it's something, John, maybe, and Julie, we should think about a little bit about whether or not we want to, early on in the pandemic, we made available supplies, and that was partially because we were the only ones that could get them easier than others. So that might be something we think about. And if you hear those needs, I think if you could pass those along to us, that's something we could certainly figure out some ways to make happen, whether that's through the business community and the chamber. And I really like Gina's comment and certainly Kelly's and others about, we did end the season pretty well from a financial standpoint, certainly better than in the past. And one of the things that I was worried about was that all the online shopping that was occurring would fall off, and hope people went back to their brick and mortars. Well, it appears that people not only went back to our brick and mortars, but they stayed online too. So that's a good thing. And so that's a positive takeaway that I think has put a lot of folks in a better position than what they've been in. So those are just some observations, and that's everybody's used pivoting and how we adjust along the way. Certainly that's something we've all learned to do based on the circumstances, but we're certainly doing more things remotely. We're incentivizing different aspects. And so some of our leaves that we have relative to COVID, which technically went away, those can be challenges. So especially when people are having to experience and use that, whether it's staying home with their kids or whatever the case may be. So thank you, everybody. for your input.
Anything else before we move on? Viv?
Just really quick, we are going to continue messaging from the health department to try and let people know what the situation is and answer the questions as best we can. The plan is to have a weekly written update every Wednesday, and we'll respond to the requests for more Facebook Live updates if needed.
So last thing we want to do is circle back to that draft document that was put together a few months ago. I think also recognizing that document review in a group of greater than like 3 or 4 is a challenge. So I don't know, Ron, if any comments or thoughts, because obviously we were appointed by the mayor originally, and so I think that's kind of who we will need to circle back to with some sort of lessons learned, if you will.
Right. That was kind of the thought process, was to create this type of a document as well as attach some of the graphics and different things we produced. There was quite a huge effort to help the businesses out in creating some prototypes and different aspects that they could put in place. So that would all be part of it. But yeah, if all of you could just read through the draft of the lessons learned document, and as I started out with, there's a lot of, we're still learning. And so some of those things may no longer be actually as applicable as maybe they once were. So if there's edits that you'd like to suggest, I would suggest you email those to me. Technically, we shouldn't do a reply all to the group because you can't have an online meeting that's not noticed. So if I will collect all those comments and provide them back out to the group at various stages. So yeah, if there's edits you want to make, additions, deletions, add to it, citing other information and other types of, as we just look at the history of guidance that has changed dramatically through this COVID procedure, it's certainly a document that can help us for the next one, whenever that may be, hopefully a long time from now. But with each event, I think we learn a little bit more, whether it's a pandemic or a flood or whatever the case may be. So thank you. That would be my strategy for taking some input on, and then we can just communicate via email relative to the document, and hopefully have maybe one more wrap-up meeting, and that might be something the group wants to talk about if you want to meet again on a monthly basis or every other month or quarterly or whatever the case might be.
So that was the last thing I had to ask. And full disclosure, Jason and I haven't even talked about it, but we're certainly open to input on what people would like to do, when that might be that we would want to meet again, and then we will work on the logistics of that.
I just had a comment, I guess. I don't know if anybody's, maybe this might be kind of out of context here, but has read Sanjay Gupta's latest book called World War C. I picked it up at the library, and I think it has some pretty good advice, maybe for us to kind of look and consider kind of moving forward, kind of a playbook, shall we say. I think that we've kind of talked about here. But I would kind of suggest that maybe all of us pick up that book and read it, and maybe come up with some suggestions, based upon, some of the experiences that were learned, not only just, amongst us in our community, but, as a whole, outside of us here, for our state and, federally as well. Just a thought.
Any, I guess, there any other comments, Ron? Do we need to take care of any other business?
No, that's kind of all we had lined up. I appreciate everybody's time and willingness to participate and share your observations. And if you have suggestions, certainly you can email Bob and Jason and myself, and we can kind of go from there. And again, thank you all for your time. Dennis Butler, thank you for serving on the task force, and we appreciate you taking up the time to do that.
My pleasure. Thank you all.
Dennis, thank you so much. You've been such a great pal and such a positive, you have, I so have enjoyed your leadership and, just your philosophy, going, as our law enforcement dude. And, you really have put a really great positive look and output for, the department. And so you're going to be hard to replace, man, but I really do. I just wanted to take the opportunity to say thank you. And, in the industry that I work in, cops don't have a good rap, dude. So, I can tell you that you have been extremely fair. You have a really great perspective of looking at it through the lens of, another lens, shall we say, on the other side. So yeah, thank you. Thank you for giving a big, good overall picture of what cops can be in a community and what leadership for law enforcement can really look like. So I think that you've done a really, amazing job. So thank you.
Likewise, Linda Cook, thank you for all your contributions. You had a different kind of firefighting experience with COVID, and certainly one of the bigger groups as Fort Riley has well. But we'll miss you as well. You've been a great contributor and a great team player. So thank you.
Thanks. You're in good hands with Kevin, so I'll make sure you have his email address so you get forward the new meeting notices to him. So thanks. It's been a great working with all of you.
Okay, so I'm out of the loop. Linda, are you leaving?
I'm retiring. I'm retiring.
Oh, you go, girl.
I'll have more time to spend at your bar.
I'll look forward to hanging out with you on the other side at the corner, Linda.
All right.
Hey, this is Steve out at Fort Riley. Linda, it's Kevin who?
Kevin Nillette. Air Force.
All right, thanks.
I'll send him your email too.
Perfect.
Well, Kelly, if I could just, first of all, thank you for your kind comments, but this is to all of you because you all represent different segments of our community. I learned a long time ago, and I can't profess that I've done it perfectly, but I learned a long time ago that when you're in policing, you deal with a lot of different crises and people who have needs and perspectives that are often different from your own. And I always try to be a good listener. Again, I'm not sure if I'm always successful, but I think it is critically important when you're in the role that I'm in to go out and meet these people, get to know them, let them get to know you so you can have conversations and work hard to put yourself in their shoes and try to see things from their perspective. at the end of the day, you may not always agree, but at least if you give an answer and the rationale behind the reason or the answer, I think that's very satisfactory to a lot of people. And again, it takes a lot of extra effort to do that. The last couple of nights I've been at governing body meetings in Randolph and Riley, and plan on continuing to do that. No matter where you live or work in Riley County, you matter and should matter to the police department, no matter what those various needs are. And so that's what I have tried to do. And I am very humbled, Kelly, that you would say what you did. So thank you so much.
I don't say a lot of bullshit, Dennis. At least, you know, I'm pretty honest on my feelings towards people. So that was really true. So thank you.
Okay, well, I think we'll wrap it up then. Bob, do you have anything before we go? All right.
Wear a mask. Vaccinated.
Thanks for everybody.
Thanks.
Short notice.
You're well.
Thanks, everybody. Appreciate it.